Does your child avoids eye contact or sits for a long time? Or the child is always on the move? The child is not able to sit even for a few minutes. Today, many parents get confused between autism and ADHD. They don't even know what is the clear difference between autism and ADHD. In this video, I will clearly explain the difference between autism and ADHD. Hi everyone, I'm Griselda Evangeline, Paediatric Occupational Therapist at Lorem Wellness Care. I will break down the topics on what is autism, what is ADHD, and key differences between them and how occupational therapy can help. Autism is autism spectrum disorder. It is a neurodevelopmental condition which affects three areas: social communication, social interaction, and behavior patterns. Social communication is where the child tries to convey the meaning or is a means of passing information. Social interaction is understanding the social cues like body language, gestures, eye contact, and the emotional tone of the message. Behavior patterns like restrictive or repetitive behaviors. Children with autism show symptoms like they prefer to play alone, avoid eye contact, delayed speech, sensory sensitivities, restrictive or repetitive behaviors like head banging, body rocking, toe walking, hand flapping. ADHD stands for Attention Deficiency Hyperactivity Disorder. It mainly affects attention, hyperactivity, impulsivity. Children with ADHD show symptoms like getting distraction easily, they always move around or keeps on running, interrupts conversation or over talking. They can't even complete the task or they can't even sit even for few minutes to complete the task. And they have difficulty in waiting for their turns. There are four key differences between autism and ADHD: social interaction, attention, behavior patterns, and communication. Social interaction in autism. They have difficulty in understanding the social cues, which is like body language, maintaining eye contact, or emotional tone of the message. Whereas in ADHD, they can understand the social rules of interactions, but because of their hyperactivity, impulsivity, social interaction is affected. Attention. Attention in autism, they have sustained attention in preferable activities like their favorite activities which they have interest on, but not the activities that we give it to them. Whereas ADHD, they have difficulty in sustaining attention even for preferable activities because they keep on shifting from one activity to another activity. Behavior pattern in autism. It is either repetitive behavior or restrictive behavior. Repetitive behavior is like hand flapping, body rocking, toe walking, or head banging. There are different behaviors which you can see in children with autism which are repetitive in daily routines. They also want same routines every day. They don't want changes in routines because they find it difficult to adapt to changes in routines. Whereas in ADHD, their behavior patterns are constant movements. They cannot even sit in one place. They are always on the move, or you find it difficult for making them to sit in one place. Communication. Communication in autism. Children with autism shows delayed in speech, or they have unusual communication style like echolalia, repetition of words. Communication in ADHD is normal, where the language development is typical, but they have difficulty in communication like talking excessively or interruptions of communication. Some children can have both autism and ADHD together. That is why Proper assessment by developmental pediatrician or pediatric occupational therapist is very important. How pediatric occupational therapy can help. In pediatric occupational therapy, we focuses on improving attention and sitting tolerance, improving social interaction skills, enhancing communication skills, sensory integration therapy, behavior regulation strategies, and activities of daily living skills. Every child's therapy is individualized and goal-directed planned. Thank you.